So how did I then get into this foundation? I think it actually started in 1999 when I was at WHO, leading the tobacco program, when I believed as a scientist that we needed to know what the industry knew about harm reduction. Because if they had something they could tell us, we would want to advance it in the Framework Convention. A decade later, or a little bit more than a decade later, we started seeing the uptake of e-cigarettes. And that led me in another job to review what did we really see happening in the two fields of snus and e-cigarettes. And what shocked me was that we in public health had actually ignored the evidence for 3-4 decades of massive differences in cancer rates in Sweden, driven by snus, and the massive emergence of millions of people moving into e-cigarettes, of which I knew little at the time. Clearly, this was a harm reduction intervention par excellence that, if expanded globally, would have a massive impact on lowering the risk. It would be a fundamental change. Hundreds of others across the world were starting to respond to what consumers sought, which was reducing their personal risk, either quitting completely if they could, but certainly reducing their risk with products that would take the bad stuff out. Our funding is going exactly to where they're saying the weaknesses exist. Accelerating smoking cessation, addressing harm reduction, addressing many of the gender concerns that are rising, addressing the needs of vulnerable groups, and importantly, investing in science in developing countries where the current level of investment is pitiful.